Hey, Alpha Nurses, I'm Licensure from AlphaNurseGuide.com. This is 25 practice NCLEX questions. Without the way, let's get started.
Which of the following should the nurse include when completing discharge instructions to the parents of a 12-month-old child diagnosed with Kawasaki disease and being discharged home? 1. Offer the child extra fluids every 2 hours for 2 weeks. 2. Take the child's temperature daily for several days. 3. Check the child blood pressure daily until the follow-up appointment. 4. Call the primary healthcare provider if the irritability lasts for 2 more weeks. The correct answer is 2. The child's temperature should be taken daily for several days after discharge because recurrent fever may develop. Offering the child fluids every 2 hours is not necessary. Doing so increases a child's risk for CHF. Checking the child's blood pressure at home usually is not included as part of the discharge instructions because by the time of discharge, the child is considered stable and the risk for cardiac problems is minimal. Most children with KD recover fully. Irritability may last for 2 months after discharge. The nurse is teaching the parents of a child with sickle cell disease. To instruct them on how to prevent sickle cell crisis, she should include which instruction? 1. Restrict the child's fluid intake to less than 1 quart per day. 2. Drink at least 2 quarts of fluids per day. 3. Stay away from other teenagers. 4. Avoid physical activity. The correct answer is 2. Increasing fluid intake and being well hydrated will help prevent cell stasis in the small vessels. Restricting fluids causes stasis of red blood cells and promotes obstruction and increases the chance of sickling with hypoxia and pain to the part that is involved. Clients with sickle cell disease should stay away from others who have infections. When the spleen of a client who has sickle cell disease has become fibrotic and non-functional, the client is more susceptible to infections. Clients with sickle cell disease should not avoid physical activity as long as the client stays well hydrated. The mother asked the nurse why her child's hemoglobin was normal at birth, but now the child has S hemoglobin. Which of the following responses by the nurse is appropriate? 1. The placenta bars passage of the hemoglobin S from the mother to the fetus. 2. The red bone marrow does not begin to produce hemoglobin S until several months after birth. 3. Antibodies transmitted from you to the fetus provide the newborn with temporary immunity. 4. The newborn has a high concentration of fetal hemoglobin in the blood for some time after birth. The correct answer is 4. Sickle cell disease is an inherited disease that is present at birth. However, 60% to 80% of a newborn's hemoglobin is fetal hemoglobin, which has a structure different from that of hemoglobin S or hemoglobin A. Sickle cell symptoms usually occur about 4 months after birth, when hemoglobin S begins to replace the fetal hemoglobin. The gene for sickle cell disease is transmitted at the time of conception, not passed to the placenta. Some hemoglobin S is produced by the fetus near term. The fetus produces all its own hemoglobin from the earliest production in the first trimester. Passive immunity conferred by maternal antibodies is not related to sickle cell disease, but this transmission of antibodies is important to protect the infant from various infections during early infancy. A mother asked the nurse if her child's iron deficiency anemia is related to the child's frequent infections. The nurse responds based on the understanding of which of the following? 1. Little is known about iron deficiency anemia and its relationship to infection in children. 2. Children with iron deficiency anemia are more susceptible to infection than are other children. 3. Children with iron deficiency anemia are less susceptible to infection than are other children. 4. Children with iron deficiency anemia are equally as susceptible to infection as are other children. The correct answer is 2. Children with iron deficiency anemia are more susceptible to infection because of marked decreases in bone marrow functioning with microcytosis. Which of the following foods should the nurse encourage the mother to offer to her child with iron deficiency anemia? 1. Rice cereal, whole milk, and yellow vegetables. 2. Potato, peas, and chicken. 3. Macaroni, cheese, and ham. 4. Pudding, green vegetables, and rice. The correct answer is 2. Potatoes, peas, chicken, green vegetables, and rice cereal contain significant amount of iron and therefore will be recommended. Milk and yellow vegetables are not good iron sources. Rice by itself also is not a good source of iron. Macaroni, cheese, and ham are not high in iron. While pudding and green vegetables contain some iron, the better diet has protein and iron from chicken and potato. A diagnosis of hemophilia A is confirmed in an infant. Which of the following instructions should the nurse provide to parents as the infant becomes more mobile and starts to crawl? 1. Administer 1/2 of a children's aspirin for a temperature higher than 101 degrees Fahrenheit. 2. Sew thick padding into the elbows and knees of the child's clothing. 3. Check the color of the child's urine every day. 4. Expect the eruption of the primary teeth to produce moderate to severe bleeding. The correct answer is 2. As the hemophilic infant begins to acquire motor skills, the risk of bleeding increases because of falls and bumps. Such injuries can be minimized by padding vulnerable joints. Aspirin is contraindicated because of its antiplatelet properties, which increase the infant's risk for bleeding. Because genitourinary bleeding is not a typical problem in children with hemophilia, urine testing is not indicated. Although some bleeding may occur with tooth eruption, it does not normally cause moderate to severe bleeding episodes in children with hemophilia. Because of the risks associated with administration of factor VIII concentrate, the nurse should teach the child's family to recognize and report which of the following? 1. Yellowing of the skin. 2. Constipation. 3. Abdominal distension. 4. Puffiness around the eyes. The correct answer is 1. Because factor VIII concentrate is derived from large pools of human plasma, the risk of hepatitis is always present. Clinical manifestations of hepatitis include yellowing of the skin, mucous membranes, and sclera. Use of factor VIII concentrate is not associated with constipation, abdominal distension, or puffiness around the eyes. The healthcare provider has determined that a preterm labor client at 34 weeks gestation has no fetal fibronectin present. Based on this finding, the nurse would anticipate that within the next week, 1. The client will develop preeclampsia. 2. The fetus will develop mature lungs. 3. The client will not develop preterm labor. 4. The fetus will not develop gestational diabetes. The correct answer is 3. The absence of fetal fibronectin in a vaginal swab between 22 and 37 weeks gestation indicates there is less than 1% risk of developing preterm labor in the next week. Fetal fibronectin is an extracellular protein normally found in fetal membranes and deciduous and has no correlation with preeclampsia, fetal lung maturation, or gestational diabetes. A multigravida client at 34 weeks gestation is being treated with indomethacin to halt preterm labor. If the client gives birth to a preterm infant, the nurse should notify the nursery personnel about this therapy because of the possibility for which of the following? 1. Pulmonary hypertension. 2. Respiratory distress syndrome. 3. Hyperbilirubinemia. 4. Cardiomyopathy. The correct answer is 1. Indomethacin has been successfully used to halt preterm labor. However, if the client should give birth to a preterm infant, the nurse would notify the nursery personnel about the tocolytic therapy because this drug can lead to premature closure of the fetal ductus arteriosus, resulting in pulmonary hypertension. Prematurity is associated with RDS because of the immaturity of the fetal lungs. RDS is not a result of indomethacin. Hyperbilirubinemia is more common in preterm infants. Use of indomethacin to halt preterm labor is not associated with cardiomyopathy in the infant. In which of the following maternal locations would the nurse place the ultrasound transducer of the external electronic fetal heart rate monitor if a fetus at 34 weeks gestation is in the left occipital-anterior position? 1. Near the symphysis pubis. 2. 2 inches above the umbilicus. 3. Below the umbilicus on the left side. 4. At the level of the umbilicus. The correct answer is 3. As the uterus contracts, the abdominal wall rises, and when external monitoring is used, presses against the transducer. This movement is transmitted into an electrical current, which is then recorded with the fetus in the LOA position. The cardiotransducer should be placed below the umbilicus on the side where the fetal back is located and uterine displacement during contractions is greatest. If the fetal back is near the symphysis pubis, the fetus is presenting as a transverse lie. If the fetus is in a breech position, the fetal back may be at or above the umbilicus. When preparing a multigravida client at 34 weeks gestation, experiencing preterm labor for the shake test performed on amniotic fluid, the nurse would instruct the client that this test is done to evaluate the maturity of which of the following fetal systems. 1. Urinary. 2. Gastrointestinal. 3. Cardiovascular. 4. Pulmonary. The correct answer is 4. The shake test helps determine the maturity of the fetal pulmonary system. The test is based on the fact that surfactant foams, when mixed with ethanol, the more stable the foam, the more mature the fetal pulmonary system. Although the shake test is inexpensive and provides rapid results, problems have been noted with its reliability. Therefore, the lecithin-sphingomyelin ratio is usually determined in conjunction with the shake test. A prima gravida client at 30 weeks gestation has been admitted to the hospital with premature rupture of the membranes without contractions. Her cervix is 2 centimeters dilated and 50% effaced. The nurse should next assess the clients. 1. Red blood cell count. 2. Degree of discomfort. 3. Urinary output. 4. Temperature. The correct answer is 4. Premature rupture of the membranes is commonly associated with chorioamnionitis or an infection. A priority assessment for the nurse to make is to document the client's temperature every 2 to 4 hours. Temperature elevation may indicate an infection. Lethargy and an elevated white blood cell count also indicate an infection. The red blood cell count would provide information related to anemia, not infection. The client is not in labor. Therefore, assessing the degree of discomfort is not a priority at this time. Urinary output is not a reliable indicator of an infection, such as chorioamnionitis. A prima gravida client at 36 weeks gestation with premature rupture of the membranes is to be discharged home on bed rest with follow-up by the home health nurse. After instruction about care while at home, which of the following client statements indicates effective teaching? 1. It is permissible to douche if the fluid irritates my vaginal area. 2. I can take either a tub bath or a shower when I feel like it. 3. I should limit my fluid intake to less than 1 quart daily. 4. I should contact the doctor if my temperature is 100.4 degrees Fahrenheit or higher. The correct answer is 4. Because of the client's increased risk for infection, successful teaching is indicated when the client states that she will contact the doctor if her temperature is 100.4 degrees Fahrenheit or greater. The client should be instructed to monitor her temperature twice daily. The client should refrain from douching and tub bathing, which can increase the potential for infection. Showering is permitted because water in the shower doesn't enter the vagina and increase the risk of infection. A fluid intake of at least 2 liters daily is recommended to prevent potential urinary tract infection. A client with gestational diabetes who is entering her 3rd trimester is learning how to monitor her fetus's movements. After teaching the client about the kick count, the nurse should provide further instruction if the client makes which of the following statements? 1. The baby may be more active at different times of the day. 2. How I feel my baby move is different than my friend. 3. The baby should be moving less than 10 times in 2 hours. 4. The baby may not move at times because it is asleep. The correct answer is 3. Feeling 4 kicks in 30 minutes or feeling 10 or more kicks in 2 hours are norms. Fetuses are more active at various times of the day, particularly after mother has eaten when the blood glucose level is high, and in the evening. Each individual perceives their fetus to move differently. Fetuses do sleep several times per day for about 30 minutes each time. A prima gravida client with insulin-dependent diabetes tells a nurse that the contraction stress test performed earlier in the day was suspicious. The nurse interprets this test result as indicating that the fetal heart rate pattern showed which of the following? 1. frequent late decelerations. 2. Decreased fetal movement. 3. Inconsistent late decelerations. 4. Lack of fetal movement. The correct answer is 3. A contraction stress test is used to evaluate fetal well-being during a simulated labor. A suspicious contraction stress test indicates inconsistent late deceleration patterns requiring further evaluation. A negative contraction stress test indicates no late decelerations and is a desired outcome. A positive contraction stress test indicates fetal compromise with frequent late decelerations. Fetal movements are one of the parameters of biophysical profile and are detected with non-stress testing. Decreased or absent fetal movements may indicate central nervous system dysfunction or prematurity. Lack of fetal movement or decreased fetal movement is not associated with contraction stress testing. A 30-year-old multigravida client at 8 weeks gestation has a history of insulin-dependent diabetes. Since age 20, when explaining about the importance of blood glucose control during pregnancy, the nurse should tell the client that which of the following will occur regarding the client's insulin needs during the first trimester. 1. They will increase. 2. They will decrease. 3. They will remain constant. 4. They will be unpredictable. The correct answer is 2. During the first trimester, it is not unusual for insulin needs to decrease, commonly as a result of nausea and vomiting. Progressive insulin resistance is characteristic of pregnancy, particularly in the second half of pregnancy. It is not unusual for insulin needs to increase by as much as 4 times the non-pregnant dose after about the 24th week of gestation. This resistance is caused by the production of human placental lactogen, also called human chorionic somatotropin, by the placenta and by other hormones, such as estrogen and progesterone, which are insulin antagonists. When developing a teaching plan for a prima gravida client with insulin-dependent diabetes about monitoring blood glucose control and insulin dosages at home, which of the following would the nurse expect to include as a desired target range for blood glucose levels? 1. 40 to 60 milligrams per deciliter between 2 o'clock and 4 p.m. 2. 70 to 100 milligrams per deciliter before meals and bedtime snacks. 3. 110 to 140 milligrams per deciliter before meals and bedtime snacks. 4. 140 to 160 milligrams per deciliter 1 hour after meals. The correct answer is 2. The goal is to maintain blood plasma glucose levels at 70 to 100 milligrams per deciliter before meals and bedtime snacks. Below 60 milligrams per deciliter indicates hypoglycemia. A range of 110 to 140 milligrams per deciliter suggests hyperglycemia. The target range 1 hour after meals is 100 to 120 milligrams per deciliter. After teaching a diabetic prima gravida about symptoms of hyperglycemia and hypoglycemia, the nurse determines that the client understands the instruction when she says that hyperglycemia may be manifested by which of the following? 1. Dehydration. 2. Pallor. 3. Sweating. 4. Nervousness. The correct answer is 1. Dehydration, polyuria, fatigue, flushed hot skin, dry mouth, and drowsiness are manifestations of hyperglycemia. Hyperglycemia is a medical emergency and requires immediate action to prevent maternal and fetal mortality. Pallor, sweating, and nervousness are early signs of hypoglycemia, not hyperglycemia. A prima gravida client with diabetes at 39 weeks gestation is seen in the high-risk clinic. The primary health care provider estimates that the fetus weighs at least 4,500 grams. The client asks, "What causes the baby to be so large?" The nurse's response is based on the understanding that fetal macrosomia is usually related to which of the following? 1. Family history of large infants. 2. Fetal anomalies. 3. Maternal hyperglycemia. 4. Maternal hypertension. The correct answer is 3. Maternal hyperglycemia and poor control of the mother's diabetes mellitus have been implicated in fetal macrosomia. When the mother is hyperglycemic, large amount of amino acids, free fatty acids, and glucose are transferred to the fetus. Although maternal insulin does not cross the placenta, the fetal pancreas responds by hypertrophy of the islet cells of the pancreas. The islet cells produce large amounts of insulin, which acts as a growth hormone. A family history of large infants usually is not the reason for large for gestational age fetuses in diabetic mothers. Maternal hypertension is associated with small for gestational age fetuses because of vasoconstriction of the maternal and placental blood vessels. After instruction of a prima gravida client at 8 weeks gestation diagnosed with class 1 heart disease about self-care during pregnancy, which of the following client statements would indicate the need for additional teaching? 1. I should avoid being near people who have a cold. 2. I may be given antibiotics during my pregnancy. 3. I should reduce my intake of protein in my diet. 4. I should limit my salt intake at meals. The correct answer is 3. The client needs a diet that is adequate in protein and calories to prevent anemia, which can place additional strain on the cardiac system, further compromising the client's cardiac status. The client should avoid contact with people who have infections because of the increased risk for developing endocarditis. The client may need antibiotics during the pregnancy to prevent endocarditis. Limiting sodium intake can help to prevent excessive expansion of blood volume and decrease cardiac workload. When developing a collaborative plan of care with the healthcare provider for a multigravida client at 10 weeks gestation with a history of cardiac disease who was being treated with digitalis therapy before this pregnancy, the nurse should instruct the client about which of the following regarding the client's drug therapy regimen. 1. Need for an increased dosage. 2. Continuation of the same dosage. 3. Switching to a different medication. 4. Addition of a diuretic to the regimen. The correct answer is 2. Unless the client has cardiac decompensation during the pregnancy, she will most likely be able to continue taking the same dose of medication. The client may be prescribed prophylactic antibiotics, particularly if she has had rheumatic fever. The medication will be switched only if digitalis toxicity occurs. A diuretic is added only if congestive heart failure is not controlled by sodium and activity restrictions. A prima gravida client with class 2 heart disease who is visiting the clinic at 8 weeks gestation tells the nurse that she has been maintaining a low sodium, 1,800 calories diet. Which of the following instructions should the nurse give the client? 1. Avoid folic acid supplements to prevent megaloblastic anemia. 2. Severely restrict sodium intake throughout the pregnancy. 3. Take iron supplements with milk to enhance absorption. 4. Increase caloric intake to 2,200 calories daily to promote fetal growth. The correct answer is 4. The client can continue a low-sodium diet but should increase the caloric intake to 2,200 calories daily to provide adequate nutrients to support fetal growth and development. Folic acid supplements, a standard component of care, are used to prevent folic acid deficiency, which is associated with megaloblastic anemia during pregnancy. Severe restriction of sodium intake is not recommended because sodium is necessary to maintain fluid volume. Iron supplements should be taken with acidic foods and fluids for maximum absorption. Milk decreases the absorption of iron. The nurse is caring for a client with a suspected diagnosis of hypercalcemia, which sign/symptom is an indication of this electrolyte imbalance. 1. Twitching. 2. Positive Trousseau sign. 3. Hyperactive bowel sounds. 4. Generalized muscle weakness. The correct answer is 4. Generalized muscle weakness is seen in clients with hypercalcemia. Twitching, positive Trousseau sign, and hyperactive bowel sounds are signs of hypocalcemia. A multigravida client diagnosed with probable ruptured ectopic pregnancy is scheduled for emergency surgery. In addition to monitoring the client's blood pressure before surgery, which of the following would the nurse assess? 1. Uterine cramping. 2. Abdominal distension. 3. Hemoglobin and hematocrit. 4. Pulse rate. The correct answer is 4. Fallopian tube rupture is an emergency situation because of extensive bleeding into the peritoneal cavity. Shock soon develops if precautionary measures are not taken. The nurse readying a client for surgery should be especially careful to monitor blood pressure and pulse rate for signs of impending shock. The nurse should be prepared to administer fluids, blood, or plasma expanders as necessary through an intravenous line that should already be in place. Because the fertilized ovum has implanted outside the uterus, uterine cramping is unlikely. However, abdominal tenderness or knife-like pain may occur. Abdominal fullness may be present, but abdominal distension is rare unless peritonitis has developed. Although the hemoglobin and hematocrit may be checked routinely before surgery, the laboratory results may not truly reflect the presence or degree of acute hemorrhage. A multigravida client is admitted to the hospital with a diagnosis of ectopic pregnancy. The nurse anticipates that, because the client's fallopian tube has not yet ruptured, which of the following may be prescribed? 1. Progestin contraceptives. 2. Medroxyprogesterone. 3. Methotrexate. 4. Diphyline. The correct answer is 3. Because the fallopian tube has not yet ruptured, methotrexate may be given, followed by leucovorin. This chemotherapeutic agent attacks the fast-growing zygote and trophoblast cells. RU-486 is also effective. A hysterosalpingogram is usually performed after chemotherapy to determine whether the tube is still patent. Progestin-only contraceptives and medroxyprogesterone are ineffective in clearing the fallopian tube. Diphyline is a bronchodilator and is not used.
You can get my NCLEX review bundle. Links will be in the description. I'll see you guys in the next video.